We're now on Chapter 5, the 12 leads and acute MIs. In this video, we're going to talk about each individual lead that makes up a 12-lead EKG and look at one way to determine if a patient is having an acute MI based on ST segment elevations. Okay, diagnosing an MI. You need to go beyond looking at a rhythm strip. You have to obtain a 12 lead. Let's take a look at a 12 lead. Okay, that's your standard 12 lead. Notice at the bottom, right there, that's your typical rhythm strip that you normally are viewing when you have a patient on telemetry or cardiac monitor. And that's lead 2. Remember, that's our reference lead. Okay, and there's the 12 lead EKG broken out for you. Okay. So each lead is looking at a different view of the heart. They're like 12 individual cameras located in 12 different positions that give you an overall view of the whole heart. So that's important. It helps us determine where problems are going on within the heart itself. Okay. Okay. The 12 leads include, you have 3 limb leads. This is lead 1, 2, and 3. Okay. You also have 3 augmented leads. These are also considered limb leads, and in practice, it's actually leads 1, 2, and 3, where the EKG machine changes the augments the voltage of these leads, and that gives us a different view of the heart. How it does that is because your 3 limb leads are bipolar leads. They're recording electrical activity moving from a positive to a negative lead or negative to positive. And the augmented leads are unipolar. It only has a positive end. And so it's going to record information. It's going to record electrical activity moving from the positive end from a particular set point made up of the other limb leads. So as you can see, there's our augmented leads. Electrical activity is going to be moving toward the positive end, but it's coming from a midpoint between these 2 leads. Okay? So that's actually called a null point. Okay. You also have 6 precordial leads. These are your chest leads, and these are V1 through V6. Okay. Okay, views of the heart. So some leads get a good view of the heart based on their location. It gives you a better idea what's going on at that particular area of the heart. So let's take a look at the anterior portion of the heart. Okay. Inferior portion of the heart. Lateral portion of the heart. Okay, so if a patient is experiencing acute MI, looking at these specific individual leads, you're going to want to look for ST elevation. ST elevation is the area of baseline between the S wave and the T wave. And ST segment should always be isoelectric, horizontal, isoelectric, to the patient's baseline, meaning that this is a portion of isoelectric activity. Should be flat, should be even. If you have elevation above that baseline, could indicate an acute MI. So, let's see. Okay, let's take a look. Okay, and what you're going to look for when assessing for ST elevation, if the elevation is greater than 1 small box in 2 leads, and if so, that's consistent with an acute MI. Okay. There's ST elevation in lead V2, V3, V4, V5, and V6. anterior view of the heart is the leads V1 through V4 are the leads that give you the best view of the anterior of the heart. Also, V1 and V2 gives you a great picture of the septal wall, but that's still considered the anterior portion of the heart. So if you see changes in leads V1 and V4, ST elevation, you can conclude that that's the area of the heart in which the coronary artery that serves it is occluded. Okay, let's put it all together. Take a look at the EKG. See if you can spot whether or not this patient's having an acute MI. And if so, can you locate where? Okay. They are. Let's take a look at where our ST elevations are at. There you go. V1 and V2, which we just said that's covering the anterior portion of the heart. That's actually probably a septal wall MI. Okay, so let's look at the other locations. Okay. Take a look at this picture again. Okay, so keep that in mind. So remember that the 12 leads of the EKG look at different portions of the heart. The limb and augmented leads, they're looking at electrical activity moving inferiorly, left to right in the frontal plane. And the chest leads, the precordial leads, they're looking at electrical activity and recording it from posterior to anterior direction or the horizontal plane. So look at the three diagrams and you can figure out where you're going to look for a lateral wall or inferior wall MI. Okay. Okay, so what leads do you think the lateral portion of the heart is best viewed? It's going to be leads 1, AVL, and V5 through V6. And don't worry too much about trying to memorize the specific leads and what areas of the heart they view. I'm going to teach you a really neat trick before this video is over that you won't have to memorize this. You'll be able to see it in your mind. Okay. Just go through. Okay. So an inferior wall MI is going to show up in leads 2, 3, and AVF. Okay. Take a look at this EKG. See if you can spot ST elevation. Sometimes when the wave forms a really low voltage, you have to look really, really close. But like right there, there's ST elevation. It's one small box above the isoelectric line. This is above the isoelectric line. This is above the isoelectric line. Okay, let's take a look at this one. Give you a moment to see if you can spot ST elevation. There we go. They were just about everywhere. It was you could see it in the anterior wall and the lateral wall. So that's considered an interior lateral wall MI. Okay, here's a neat trick. It's called Hooper's trick. This is if you draw an eye around leads 2, 3, and AVF, this is going to tell you, see how this makes an eye? These 3 leads look at the inferior portion of the heart, the inferior wall. So if you have ST elevation in lead 2, lead 3, or AVF, it's an inferior wall MI. Over here, if you have ST elevation in lead 1, AVL, V5, and V6, you're going to have a lateral wall MI. Over here, V3 or V4 is going to be an anterior wall MI. So is V1 and V2, but this is separated out to show you that this is covering the septal portion of the anterior wall of the MI. And this is just real easy for you to get blank EKG paper and draw these. After you draw them about 5 times, you will always be able to draw them around the appropriate leads. You'll be able to see it in your mind's eye. And this was put out by the Emergency Medical Council, and it's been discussed in various medical articles about how useful this is for clinicians to remember the various areas, because it gets confusing. And it's called Hooper's trick. And so there's a really nice YouTube video. And I just put a picture of the front screen to show you that the Emergency Medical Council put out, and explaining Hooper's trick, showing you the process. And it also has a real cute story about a FedEx truck that's very interesting. Okay, and that's the end of Chapter 5. Hope you have a good day. Thank you.